website. And I think I've got Peter here.
He's here.
There he is. Okay, hi, Peter. Oh, okay, so give me just a minute. I'm going to share my screen and we will get this thing rolling here. All right, everyone, that was our networking session of our agenda. So next we go through the sponsors. And you can always visit our website. This is the DAALR.com, Denver Association of Assisted Living Residences.com. On this website, we have some links right here, key links. If you are new to this business, the very first link you want to look at is the final draft. This is the regulations that they wrote about 2 years ago now, and you need to know these regulations like the back of your hand. For everybody else that's here and knows all these regulations, there are a lot of other helpful links that are on this page. If you scroll down, I've had several people ask me for a facility directory and being able to look at the reports, inspection reports, and that's really the last link on here. They kind of changed the format, but if you click on that link, it brings you right there. You can pick the facility. You can go in and look and see what their inspections have been like. Next, we have the Facebook page. We encourage everybody to join this. This is our community networking. So if you have something you want to put on there, we welcome that. If you're looking for something, we welcome that. This is a good place to share information. And again, we're just trying to build the community here. We appreciate everybody that was able to go into our meetup page and RSVP. When we are in restaurants, this is very handy because then we know how many people to expect and we can let the restaurant know. It's not as important today, but it is still nice because we also communicate through this. So when we do send out an email blast, we send it out to all the members that have joined here. So it's a good way to stay communicating with us. I went the wrong way. Next, we have our sponsors. And these are the people that help support us. And we start with the RIL National Association. We actually have Brian Pinkowski with us tonight, who is the president of this. Brian, would you like to say a few words about the organization?
Oh, just briefly, yeah. So every year, well, the National Association specifically supports associations like Verns and CALAS to help them with either research or legal support or providing vendors and buying opportunities that they don't normally have within the smaller groups. And so basically what we do is we add a little shoulder to the wheel of the great work that groups like Denver ALR and CALA are doing. And right now a full membership actually is free. You need to get an updated thing. So memberships are free for all associate members. And I'm not sure we're going to have a full membership going forward, but we do have the opportunity to have some additional boost to your marketing. We've got an ALR locator map that people can use to find your home and find out about you. And there are a number of other things that we provide.
Awesome.
Thank you.
Brian, how many people do you think are in the organization at this point?
Oh, thank you for that. It's over 45,000 people. 45,000 people, almost all of which are homeowners such as yourself. A small percentage are people who have not yet bought their homes, but overwhelmingly it's people like yourselves who do have homes.
That's terrific. So there is strength in numbers. It's very important. You have a home to go ahead and join this organization. If you're thinking about getting a home, you definitely want to be a part of this. So thanks, Brian. We appreciate the input on that. And yeah, we certainly appreciate the support that you guys give us.
You bet.
Next, we have Anderson Legal Advisors. We don't have anybody here to represent them tonight, but if you are looking for a tax advisor, these guys are great. They actually showed me a way to pay myself about $10,000 this year tax-free. So it's kind of a neat little trick that they have. They also help set up entities, LLCs, that type of thing. So we have a link to them, the AndersonAdvisors.com, and just let them know you're part of our group. And next we have the RIL Academy. And if you're interested in learning about this space, if you're not in it already and you're just getting started, this is the place to go to learn about it. These guys have got a great support program and lots of education. There's a link to them directly right here on our header, RAL. You can go to RAL Academy, and that will take you there. Next, we have Assisted Living Marketing and Peter Brissett, who is with us tonight. And Peter, would you like to talk about your company?
Sure. Thank you so much, Fern. Great to be with you guys. We've been helping assisted living communities market themselves for the while now, over 10 years now. And anything that you need there in terms of just the basics, from websites to helping with online reviews, any of that kind of stuff, that is what we do. So need help with something, let us know.
And I want to give a shout out to Peter. He did a great job on our website. He actually set up our Denver DAALR.com website, did a great job with that. And he's been extremely responsive. So much so that my wife actually just decided to move her company website over to Peter. I hope you got that email today. So we need to chat.
I did. Thank you.
You bet. Thank you. Next, we have Pinkowski Law, and we are fortunate to have both the Pinkowskis as part of our group. You know, we're blessed, really blessed. So we really appreciate these folks. And Michelle, would you like to say a little bit about your group here?
Thanks, Fern. Hi, everybody. I think almost everybody knows who we are, so I won't belabor it, but just to say we do everything related to assisted living law in Colorado, as well as elsewhere, but in Colorado, licensing, zoning, anything after like IDRs and whatnot. We are doing something new that's kind of exciting. We've been asked by RALNA now to start doing nationwide legislative and regulatory tracking. So, you know, we've been doing that on a pro bono basis here in Colorado to help stay on top of the changes to the regs and whatnot. But now, since we're doing it nationwide, we can start seeing trends and start having a broader impact for the small assisted living homes across the country. So we just started that last week, and it'll be exciting to see how that rolls out and how it affects Colorado.
Wonderful. Thanks so much, Michelle. Again, they are fantastic. If you are looking to increase your bed count, fight a neighborhood, anything to do with assisted living, they're the go-to people, and we're lucky to have them in our backyard, if you want to call Boulder the backyard. And next, we've got A Better Way Realty, which is where I hang my license. We do lease options for these group homes. And if you wanted more information about that, you could go to this website, ralleaseoptions.com. That's part of our A Better Way funding group. We currently have, I've lost count, it's either 22 or 24 homes that we currently own and lease out to operators. And we love helping existing operators expand their business. We help new operators get in and get started. So if you have any information or want any information about that, contact me. I also broker these businesses. We have 2 of them closing on Friday. I've got another one under contract right now. We've got another opportunity that may or may not go through. And we've got 4 memory care that are coming up pretty soon here. So if you're looking to buy something, I've had my finger on the pulse in this industry for a number of years. I usually know what's out there and what's available, and I'd love to help you and be your broker. So that was my little thing. Now I want to start this. We are going to have Tamara Muir, who's part of the CALA, the Colorado Association of Assisted Living, kind of lead the discussion here. And she asked that I go ahead and share this video with you. So provided I can figure this out. Can everybody see this screen with the 4133 on there? All right, so let's see if the video works.
Owners of assisted living centers in Colorado are calling on state authorities to do more to protect our older citizens from COVID. They say right now COVID positive residents are being sent back into assisted living centers. As they told CBS 4's Brian Moss, it's a recipe for disaster, Brian.
Karen, managers and owners of these assisted living centers say they are just too small to adequately quarantine and separate their COVID patients. And they say besides that, they don't really have the expertise or the know-how to tend to COVID patients. So they're asking the state health department to come up with some solutions. And here's why.
You're lighting a fire in your home, and it's just going to be an outbreak before you know it.
That's Rachel Robertson, the owner and operator of this 8-bed assisted living facility in Fort Collins. She says facilities like hers, which are basically just large homes, are at wit's end. They've had patients hospitalized with COVID who were then sent back to their assisted living centers after treatment.
If you have people with memory care who can't stay put in one room, I mean, what do you do with those people? How do you redirect them?
She says she had one patient with COVID who was hospitalized for just 24 hours before being sent back to her facility. The Colorado Assisted Living Association, which represents 650 facilities, today put out this public appeal to the state health department saying a better plan is needed, suggesting the state establish dedicated facilities for COVID positive patients from assisted living facilities.
You just don't have the means to isolate these people the way they should be isolated, so the rest of the residents can stay safe. It's just impossible.
She said sending COVID patients back to their assisted living facilities has triggered outbreaks, and it's critical to now find other alternatives.
We need to be able to place these people in a safe environment where they can heal properly and with the medical attention they need to get through this.
Now, we did call and email the state health department, but did not hear back from them. Rachel says those big field hospitals the state has set up for COVID patients would not be appropriate for elderly COVID patients who have memory and other cognitive issues. Reporting live, I'm Brian Moss, covering Colorado First.
Brian, thank you. Well, owners of assisted living centers in Colorado are calling on state authorities to do more to protect our older citizens from COVID.
Sorry, I think that was looped.
That was good.
All
It was
right.
Luke.
Did that come across audio-wise okay for you guys? Good. I've never tried to share a video like that.
Perfect.
So
Thank you, Aaron.
you bet. Okay, Tamara, would you like to take over?
Sure. So I'm Tamara Muir, and I've been an assisted living owner for about 13 years, and I've been a nurse for way too long, probably close to 40 years now. So I recently have been appointed as a board member of CALA, and we have been working really hard trying to bring back the voice of our industry, whether large or small. We definitely have some pretty significant issues that are affecting us right now with COVID especially. And so a group of us got together. So you'll probably hear from sort of a panel discussion. We want to definitely answer your questions. The history of that newscast that you just saw is we've been working on a white paper for a really long time, trying to get the health department to listen to us as an assisted living industry where we are not equipped to, especially in the smaller homes, we are not equipped to isolate or quarantine people. And as you heard Rachel say, excuse me, once it gets into our home, which is probably a matter of time with 1 in 41 Coloradoans currently infected with coronavirus, it's a matter of time. And so if we don't have a place to send our people to really appropriately quarantine and care for them, it does light up your house like fire. And it becomes the nightmare that we all probably hope we never have to encounter. So a group of us got together and we made a lot of phone calls. There's an EMR registry that all of us are supposed to be updating every day, for those of you who don't know that, if you have a facility. From that information, we called around to see if we really needed a place to move somebody, would there be availability? And pretty much the answer is no. We really had limited access. There was either insurance issues or delays. Sometimes it would take 3 to 5 days to get somebody into one of these alternate venues. And by that time, it's already spread through your house. Other issues were testing delays, where it was taking a minimum of 3 days, up to 7 days to get testing results. And so by the time you had your testing, people were already infected and spreading it all over the place anyway. So we came across a position paper, and Vern, you have that, right?
I do. Let me go ahead and share
And I'm
that.
gonna have Vern share that just so you can kind of see where the information came. We sent this out as a press release to a lot of people. And CVS called Janet, who I hope is on the call. Okay, good. Hi, Janet. They called Janet right away, and she's like, "Oh my God, they're calling, and we get to actually talk about this." And then Rachel had like a 5-minute preparation to be interviewed, so it was really a group effort. Boy, Vern, can you make that larger?
I can. Yeah. Let me move a couple of things out of the way.
And we're happy. This is on the CALA website, so that if any of you really want to have a copy of this, you can locate that. Peter has downloaded the link to that as well. But really, we just we wanted them to hear us, that there's not the availability to keep our people safe, and by regulations alone, we are not licensed to care for acutely ill, changing residents who require medical assessments, because our staff are not trained by assessment or judgment. We got the position paper out, people listened. We haven't heard anything from the state health department since this paper went out. About a week ago, they did send out new guidelines for small assisted living. I don't know if any of you have seen those, but they did sort of listen to us and hear us about communal dining and social distancing in a COVID negative home, which was totally ludicrous that we would make our people sit isolated from one another when they're already isolated from their families. So we did make some strides with that too. We are not a part of the strike force team, assisted living as a representative. Some of the big players of the skilled facilities are part of that. And recently we have been able to meet with Peter Myers, and we have a standing meeting with him every 2 weeks to kind of update what we're really going through, living every day, and the issues that we're having. And so just kind of as an introductory, we just kind of wanted to be, maybe have some dialogue, kind of a panel discussion. If any of you have encountered it in your places, what you've found from that, maybe between Janet, if you want to add a few more words, and Rachel, if you want to add also a few more words, just open it up to questions and kind of go from there.
Okay, I can take it from there. Can you guys hear me? I had some problems with connectivity. Am I good?
Yep, we
Yep.
can hear you.
Okay. We work directly with skilled partners and to find out why is no one wanting to, have COVID positive beds. And the problem is direct admit. We can't direct admit from our facilities to a skilled nursing unit. So that's the problem. And then the other problem is skilled facilities will have an increase in surveys from the state health department if they have an increase in COVID positive. So if they admit COVID positive, their rates go up. So then the infectious control department from CDPHE is on their site. And then the ramifications of that are when they renew their liability insurance the next year, then they have an increase in liability because they failed to provide infectious control measures. So that's kind of the issue with us thinking that we could admit these people to skilled, because skilled is not available to do that. Now, the state health department says that they're misinformed, but we're currently working with Peter Myers on getting that shored up so that our skilled care partners know that there's an avenue for them to open COVID beds without ramifications from CDPHE.
Rachel, do you want to make a comment?
Yeah, I'll definitely. So I actually had a complete outbreak in my home in Fort Collins where it came into the home, and we had already started testing with the state because of the staff coming and going, and you're constantly sending them out to get tested, and the test doesn't come back for 5 days. So you're out of employees for almost a week before they can come back. And finally I just got on board and was setting up testing. But at that point, we had 2 staff that had already tested positive, and we were on the brink of an outbreak at that point based on the guidelines that the state puts out on what they consider an outbreak. And then once I had a provider in the house, and I had there was several residents who had already symptoms. They knew I was having testing later in the week, so they just delayed it, and so we just went on with the testing that was scheduled later in the week. And that at that point, it was probably already too late because so many people had been exposed at that point. And then by the time we got the testing, it still took 4 days for the testing to go through. We finally had our first 2 residents that tested positive, and then we had the following week another testing, and then at that point it was a complete outbreak in the whole entire home. And you know, I've been working with several homes as far as going through my own experiences of what I've been through, and just trying to help them and redirect, and just kind of directing them and offering support to tell them, make sure you understand what you're getting into with these people who have symptoms. We just don't have the skill set to be taking these pulse ox constantly and making sure that, you know, they're breathing appropriately and they're doing okay. And it's a lot of work. And I was a skeleton crew of 4 staff members, including myself. So there was 4 of us that were just kind of rotating through all the shifts to just get through that really difficult month of October. And we got through it, thankfully. But I think what saved me was I had 2 people in the hospital at that point. So that kind of limited the amount of people we were taking care of. But there was a lot of weak people. I mean, that weakness, not a whole lot of eating. There was a lot of struggle. I had one resident I had lost one resident at the beginning. I was on the brink of losing a second resident. And I think for any business owners, it's devastating. You just don't know what you're going to even do. Financially, you don't even know what you're going to do. You're just trying to keep everybody on board. You're working through your own sickness. You're tired. You're calling the families. You're talking to the families. You're with epidemiology team. You're with the health department constantly. You're just trying to do your best and sleep in between. And then I also have kids at home homeschooling. So I know all of us have these situations in our own home or our own circumstance. It blew up on me. And thankfully, we're all good. But now we're fine. I didn't lose that second resident, but it was a lot of work. I don't know how I would have done it. But, you know, we were able, at that point when we were a total outbreak, I was starting to finally get some of my staff who were feeling better to start coming back on board and start working again. And my residents who were in the hospital, they started getting stronger, but there was no place to stick them. It really was basically me telling the hospital, unless they are strong enough to come back in their assisted living level. I mean, that's the key here, is making sure that they are appropriate to come back to you, because the nursing homes were not willing to take them back until they tested negative, and the health department's telling me, well, you're not testing again. And I said, well, how is it the hospital's asking that for a negative test when there's no option for to keep testing? And so so I didn't have an option. So I basically just said, well, until they get strong enough, then they can come back to the assisted living level. And that even took some convincing at the hospital level, because they wanted to send them back before. And I said, no, I need a visual on these people. And if I can't go there, I need you to somehow do a video chat so I can see if they're fine. And that, you know, they don't like that, but you know what? I have a license to protect. I have people to protect, and I have a duty to take care of these people as best as I can. So these are all the different challenges that we're dealing with, and you know, making sure, and thankfully they came back, and they got stronger and stronger. Every week was a better week. And I felt like probably 3 weeks ago, we finally were in a good place. We were a much better, healthy place. And so it's been quite the thing. So now I'm just trying to reach out to other places and just try to support people through that process. But being realistic with what you can do is definitely important. And just reach out to people and support. And I mean, the epidemiology team with the state and the health department were really wonderful. They really were supportive during that whole time with me, because I could see how hard it was for me. And the families, being transparent at the very beginning is so critical. That is where your main support is going to come in, with them trying to understand, because they understand that what happened to me can happen to anybody. And they understand this is a silent virus. It comes in and we just don't know. I mean, the testing, we have people now doing the testing twice a week. How good is that? I don't know. You know, that's kind of up in the air too. And I appreciate that they've sent us kits, but there's also some delay. There's some question as far as how well those tests are going. And so anyway, so if anybody has questions, I did put my contact information in the chat room. I'm more than happy to assist or guide or just support you in any way I can. So thank you.
I wanted to comment really quickly. Thank you, Rachel. So 2 things. One is since Rachel had her outbreak, we've also had a recent order from the governor that says that hospitals have the right to not admit your patients or discharge them, which can create maybe more complications and considerations as we're moving through this potentially worsening time of COVID. I think one of the things we did learn from the health department, we've talked about recovery centers, and Janet mentioned that, we really got from the health department is that they have no plans to make that happen. That will be a private party entity that will be bringing that forth. I saw somebody put in the chat about, Peter, if that was you, to put something in there happening in Boulder. So I think community involvement, being active in your community and really trying to get people to listen. I know even in Fort Collins, I've reached out to our person who's ahead of I don't know, health department stuff, Tom Gonzalez, and he has yet to respond back to me to answer any questions about moving forward. So I would encourage you to be pretty community savvy and trying to get people to hear you. Any comments? Anybody out there have had the pleasure of working with this in your home yet?
This is Maggie. I just got a positive test yesterday. We tested on Friday. We didn't get the results until yesterday morning. So the resident was able to interact with the community for 4 days. I called the CDPHE and left a message because there weren't any I can't say that word. There wasn't anybody available, so they were supposed to call me back. Nobody called me back. At 5:05, I called again and got the after hours number. I left a message on that and never heard back at all. I did call Denver County Public Health and they got back to me pretty quickly. I had a boatload of questions because I have a 39-bed facility and I am not staffed for running upstairs to people's room, and we have shared bathrooms as well, running upstairs to people's rooms, taking meds, meals, water, snacks. We have a lot of folks who smoke, taking them out to smoke, and I needed help. And I was pretty desperate on my call last night because we were a hot mess last night at the facility. Didn't hear any back from anybody. Called this morning, CDPHE again, and they said, call Denver Public Health. which I had already done yesterday. And last night I had sent Denver Public Health a whole list of questions that I had. I finally called them back today and said, can you at least, we set up a conference call for tomorrow with Denver Public Health and the state. But I said, can somebody please answer my questions before tomorrow? And I was told by both of them that they couldn't do it, that they would have to wait until the conference call tomorrow. It was so frustrating. So we're trying to do the best we can. We have a population that is mentally ill, so they do not follow the regulations very well. They are in and out of their rooms constantly. It's really been a nightmare, and I don't know what to do. So I called yesterday, I called every single nursing home that was in EM Resources that said they were accepting COVID cases, and there were probably about 20 of them. I only found one who said that they would consider taking my resident for 10 days. And I said, wow, that's fantastic. That's exactly what I'm looking for. Still haven't heard back from them. And then in the meantime, I got a call from someone else who said, well, you better be careful when you do that, because I'm a Medicaid only facility. And I made it clear to the nursing home that I was Medicaid. And the person I talked to today said, well, Medicaid may not pay for that. And I'm going, what? Seriously? So even if you find a place to put them, nobody's going to pay for them. So what do you do then?
Well, Maggie, we're trying to get that changed so that you can do a direct admit, because right now you can't do a direct admit from your facility to a skilled nursing facility. So we're trying to get that changed. There was a waiver put out by CMS that got dissolved someplace around the end of April. And so we're trying to work on that and get that reinstated, that we could do a direct admit, because right now, Maggie, you can't do a direct admit to a skilled nursing facility.
Well, and that's the problem, Janet. I mean, even if you do find someplace, by the time you go through all the paperwork and stuff like that, the 10 days is going to be up. My resident is asymptomatic, thank God, but.
I know. Well, I worked with several facilities that are taking COVID here in Denver, and they said by the time you get us the information that we need, the hospital has already filled the bed. The bed's open for about an hour.
Yeah.
So by the time you get us all the information that we need for insurance and billing, the bed's filled. So they said you are stuck with a direct admit. So we need better access to direct admit in Colorado. They have it open in other states. I've researched it. And you can direct admit and they can take care of it. But we need to, push the line here in Colorado to do a direct admit to nursing homes. And Randy Kirkendall, along those lines, Maggie, Randy Kirkendall assured us that there was a phone number we could call 24 hours a day.
Yeah, I remember that. They never
we
called me back.
We can't find the phone number.
If you call the 303-692-2700 number after hours, it tells you to leave a message and someone will call you.
Yeah.
But nobody
so we need
calls
you. That's great information for us, Maggie, because on the strike force meeting on December 11th, we will bring that to their attention again, that phone number failed.
Yes.
We have yet to find the phone number. So if you have the phone number, that would be awesome. We need to collaborate together and get that phone number, because Randy Kirkendall.
Janet, I have it right here.
Yeah. All right, send it to me through the chat, and then we need to research that, because I threatened to call at 2:30 in the morning on Sunday to make sure they were activated to take that call. And he said, oh, sure, we are. We're working on it for you. And they're not.
Yeah, so you have to leave a message and then somebody is supposed to call you back. Well, I called at 5 after 5 and at 10:30 I went to bed. So nobody called me.
So Maggie,
well, that's the awesome part of all of us working together, is we can nail down those issues.
yeah. And Maggie, the Washington Post is doing some research about whether our position statement is true to form, and calling the, Denver Post, not Washington Post. The Denver
wow,
Post,
national.
yeah, right. but in CBS, Channel 4 has a very listening ear. So if I was you, I would share this information, send an email to them, just kind of outlining what you're experiencing, because the more the CDPHE has to hear from us about what the issues are, the more we can get them to start responding to what our needs are and realize that this is not something that we just do a paper trail. This is really putting their the money where their mouth is.
So let me ask everybody something else too, because I got my own public health order from Denver County Public Health. And on there, it asked if you're going to have staffing shortages to let them know. Well, because of all the running around that we've been doing, we are having staffing shortages at night. My staff is overworked as it is, and I can't ask anybody else to work nights. So I had someone call me from HLW today. Has anybody heard of them? So anyway, there is a CARES grant that will provide staffing through December 30th for facilities that have staff shortages. But first they sent me a memo of understanding, which was 11 or 12 pages long. And then they sent me a contract that was 40 pages long. I am in the middle of a crisis right now. I don't have time to read all this stuff because I don't want to sign it and commit to paying for this outrageous amount to get some extra staff. So has anybody else had any experience with this? No?
Maggie, I saw, is that something that CDPHE put out like a week ago maybe, or a couple weeks?
Yeah, a couple weeks ago they did.
Yeah, no, I haven't looked into it because that came out after my situation, but you know, I worry about the bigger place. Exactly, that's where we're going to be in a staffing shortage, and then by the time you put that together, you're going to be moving on. But you know, we need that help immediate.
And I'm having a problem with staffing anyhow. I've had 6 dishwashers and housekeepers in the last 2 months, and that was before I had COVID. And as soon as they started working there and finding out that there was a possibility that they could get COVID, they would leave. So how am I going to find staff when I have COVID?
Exactly. That's a panic situation for all of us. And it's unfortunate. I actually researched when they offered to get us PPE. I researched it like you can't believe. And there was I couldn't get it. I couldn't get to the end factor where you could get PPE. So I believe the staffing, availability through the state is again smoke and mirrors on that.
Absolutely.
Yeah.
So we just had what turned out to be a false positive from the curative system, and we tried the state staffing option, and so we filled out the forms and things. So that was on Saturday, and so as of today, Wednesday, we never have heard from them at all. We are in Fort Collins, so I kind of doubted their ability to even be able to support us in the first place, but there's been no follow-up.
Well, and not only that, there's a disclaimer in there that it could take 4 to 6 weeks to get staff, which is, very helpful.
Because they're going to wait for that.
You'll be done.
That's
How
crazy.
did you find out it was a false positive?
Sorry, for us to put the false positive, we went, I guess, the different direction than what other folks are recommending. We could still be theoretically wrong. If anyone has any science, I'm glad to hear it today. In that we just simply tested more, and so we've in each case we have 3 negatives after a positive.
So, but how long is that taking you to get back? So when you get, for instance, I do 24-hour shifts. So by the time you get it back, they've already been working for 24 hours. But then how, by the time you get curative, how quickly were you able to get it back to prove that it, how long did it take you to get all of the other tests that you did back to find out that it was a false positive? How long
So
did that?
we used every resource we could find. The one that we feel the most confident in is locally in Fort Collins. There's a UC Health testing. That one is the most reliable out there, and that took about 24 to 48 hours for each of them to get that back. It did create it. We had to take a risk of putting the resident that was positive in a vehicle and doing that, full PPE and stuff. The staff member went on their own. They also used one of the rapid screens, and then we also got the batch of curative back as well. So the three combined. The resident tested positive earlier and has had 2 curatives and 1 through the UC Health system.
We used
And you're right. You're right. The time frame doesn't help you. We were toast when we got the first positive test, because just like you guys know, that resident had been interactive with the rest of the residents for 4 days at that point, from when they would have tested positive. And so we kind of knew we were toast. We thought we were in an immediate outbreak, and these were just follow-up because we weren't seeing symptoms manifesting, and we wanted to be sure what were we dealing with. And quite frankly, the resident who tested positive is one of the most isolated individuals in the whole state of Colorado. So it made no sense that would be our first case. So it piqued our interest to start with, that things might not be right.
Well,
We actually had this.
Go ahead, Liz.
We had the exact same situation happen last week. Like the one person in all of our homes that had no reason to be positive was positive. And we have found, I don't know if anybody else is using Centennial Lab down in the Springs, but I cannot say enough great things. Like, our results are back within 24 hours. They pick up wherever you want, wherever the test is, they'll pick it up for you, or you can FedEx them. They drop off supplies for us. And so for our residents, we've done that with staffing as well. When we want a fast turnaround for staffing, you have to pay for it because they're not getting the federal money. But if you need a fast turnaround, between that and the antigen testing has been, has been really helpful.
So
Liz, can you share that information for that lab?
Yeah, absolutely. Thank you.
And then I just wanted to say that part of the information that I got from Denver Public Health was that I should not be testing the positive resident again for 90 days.
Yeah. Actually, I was going to say that I work at the Bigger Box Communities up here in Fort Collins, and the residents, once they've tested positive, the CDC has told these communities, do not test this resident again for 90 days.
Because
because they shed the virus for the next 90 days. So one day you could test them, they could be negative. The next day, if they're shedding it, they're going to be positive.
Yeah.
So in the case of like the false positive, are you not going to be testing them for 90 days?
If they test positive, they've told these communities, once they test positive, you don't test them again for 90 days because they could come back positive or negative, and so you just don't know. So they said do not test them for 90 days.
Oh.
I kind of went like with you, Erin. When I see one person that's kind of a lone wolf and hasn't had any exposure, for me, it was a curiosity thing, because we've had an outbreak in another house, and it was very, like, we watched it spread through the house. So to have one lone wolf, to me, actually, it was just interesting to test again and do multiple tests, even though you're right, it's not recommended. It was very interesting to see that, because nobody else in that house, no staff, nobody got sick. In our other house where we had legitimate cases, there was definitely a track that it followed. And so for me, it was more interesting as an NP.
Yeah, for us, it was because we got the news on Thursday, literally right after eating Thanksgiving dinner. And, of course, it sent chills down all of us. And And we kind of panicked from Thursday through Friday. You know, we went into instant response mode, and quite frankly, almost sent the lady to the ER with, you know, what's really just allergy symptoms. And then as the week, basically it became a waiting game. So we're going through the weekend waiting for any type of a symptom to start popping up somewhere with somebody, and finding nothing, we decided to start doing the testing. And that's where we got a series of 3 negatives. Now, if someone has science that tells me that the approach we've taken is wrong and we should actually still be in a total and complete response mode, I would greatly appreciate that.
So I've got a
Has
quick
your
question.
public health said anything to you about that? Because I understood from another facility that it was an MHCD facility. They got a positive, and then they did an antigen. MHCD did their own antigen, and then 2 negatives. So they thought they were a false positive, but the state made them stay in a quarantine mode regardless.
It's good information.
Better to be safe than be sorry.
Yeah, it's good
I'm sorry.
information.
Okay, I've got a quick question for the operators here. Is anybody doing testing in-house?
We are.
We all are.
We all are.
Okay,
It was mandated. It was mandated by Colorado Department of Health.
Twice a week.
Twice a week. Yeah.
Twice a week, unless if you have, they told me though, if you have 24-hour, 48-hour, like people that do 24, 48-hour shifts, they said that once a week would probably be sufficient, is what I was told. So if you have 8-hour shifts, that's one thing. But if you have somebody doing a couple, 2, 3, 24s, or a live-in, even, you
And
know, that would
takes-
once a week will be fine.
It takes 24 hours to get your results back? Is that what I'm hearing?
Our results have been taking 5 to 6 days because of our location. So they told me today that I only need to test once a week because of our delayed results getting back to us.
In Denver, it's taking 3 to 4 days.
Wow. So
Been 2 to 3 here.
So by the time you get the tests back, and even if your staff goes and comes and does 4 8-hour shifts, they've already been in the house and around everybody by the time you get the test back, and everybody's already infected anyway.
Well, we've been
We had a
using the
positive
Curative
staff
site.
member and we got our result back 6 days later.
Yeah. We've been getting them within 2 days, but it still leaves your staff at risk because we've been testing and then jumping the system a little bit and then testing again in 4 days. So we've been testing twice a week. But the problem is you still have staff that are on duty because they're getting tested before their shift and they're on duty for 48 hours. So there's the issue. So it's not foolproof.
Well, and I think the other problem is that CDPHE or whoever isn't taking into account, it's not just your residents. If you can't get your residents out of there and get there somewhere in isolation, your staff is getting infected and your staff is taking it home to their families, who they in turn are taking it out to others. So I think they're bubbling in the residents and not even thinking about the outbreaks outside of the residents that are in the home that haven't been able to isolate somewhere because the staff is taking it out to their families, and it just goes on and on.
Yeah, I agree with you. I totally agree with you, Janelle. Tonight, I changed my plan. Remember, all of us had to submit a plan by May 1st. I changed my plan tonight to say, if anybody has symptoms consistent with COVID, we're sending them out. We are not quarantining. We are not waiting for a result. We are sending them out upon any symptoms that mirror COVID. We are sending them out. And that's important because if you don't change your isolation plan, or that, you know, the plan that we all had to do May 1st, then they can hold you accountable for not changing that plan. So if you have a plan in place, change it.
But Janet, my plan does say that I'm going to be sending them out, but where do I send them?
Yeah, that's just
right.
Send them to the hospital.
They're asymptomatic.
It doesn't matter. Send them to the hospital anyway. And then what I'm going to do is I'm going to design a form for EMS that they won't, EMS can block the taking them to the hospital, but I'm going to design a form that says Okay, the doctor has said, send them to the hospital and you are declining to transmit them. Can you sign the form that you're personally responsible for this? They're not going to sign it. EMS will send them rather than sign that document.
That's a good idea.
Yep.
Yeah.
So of everybody
So I
here
got
that owns a
reported to the
property-
state for doing that, Janet.
For doing what?
For calling, trying to send somebody in that was not symptomatic and having them basically document, put my picture on so you guys can see me. Doesn't that make a difference when you let people talk? Yeah, they turned me in, they filed a complaint.
Well, you know what?
EMS did.
We as a industry need to just let them file the complaints. We cannot provide care for COVID residents. We can't. It's a recipe for disaster. Yeah. So we need as an industry to stand strong on that.
How many owners
I
here
agree.
have COVID in their houses?
We have a house that has COVID.
Okay, so we've got one, we've got two.
I have 1,
3, 4.
We've had one outbreak and then 2 houses that have 1 person in them. So
If you
3.
guys could raise your hand at the little reactions where you can raise your hand, we can look at the screen and kind of get a feel for how many people have actually had the COVID. Can you do it on your little reaction? Or, okay, so we've got 1, 2, 3, 4, 5.
I don't know how to do this.
I also know of 6 houses of people that aren't on here right now that currently have outbreaks.
You know, the other issue, I'm sorry, go ahead, Bert.
What I'm trying to figure out is, you know, what's the percentage of these houses that are actually having outbreaks in their houses?
But Vern, I think the biggest question right now is with us, as much as we're seeing a spike right now, it's not how many of us have it right now, it's that we are testing twice a week, and if you don't have it now, you're going to have it soon. I mean, it's just, it's impossible to keep it out. With the spike, I mean, I watch the numbers in the counties every single day. Our percentage of positives are increasing every day. And they slowed down for about 2 days, but now they're going right back up again. So no matter what we do, everybody, all of our staff, our clients that go to doctor's appointments, I mean, everybody is just going to be around it. We're all going to have our turn. So that's the part of it that I think is the most concerning is it's not if, it's when.
My Denver public health case manager told me today that since they've been testing, the cases in assisted livings have gone up 40%, and 50% of those cases are asymptomatic, which is dumbfounding to me, because otherwise, if we hadn't been testing, there would be all of these people that have COVID that are asymptomatic walking around, infecting others. So I don't know, it's horrible.
I think we have a couple of considerations, right? Is that number one, we're being mandated to test twice a week. And then we have to deal with it because they're not offering, there is no options for us to get the proper care for our clients. Or to replace staff, there's not the support for that. And I think CDPHE needs to hear from all of us to say these are the real things that we're experiencing, and the louder we talk about, the sooner they're going to have to listen to us. And you know, you guys have had some incredible stories, and I would love to have a quick email to recount those, so that when we meet with the strike force team, our small strike force team, on the 11th, that we can share that information. To try to really put the case in point that this is a real issue for us, and stop just telling us it's going to be okay, because it's not going to be okay. And the more we can stand together and share experiences, you know, Maggie, some of the things that you were sharing and what you've been told and what you're finding, those are things that we need to know. You know, with CALA, we're really trying to be kind of a go-getter industry and trying to be more proactive instead of reactive. as it has been for several years. And when we hear these stories, it gives us more ammunition to hit the target sooner and not wait until the end of the day when we're already too late to dinner. So,
So Tamara, where would you like them to send their stories to?
you know, I think if Peter, if you could put the CALA website on there, I think that'd be a central place that we could kind of collect the data. And then those of us who are on the COVID task force, Janet and Rachel and myself and Nicole, and then we can kind of pull that information together and be prepared for that when we meet with them. Jeff, are you on that committee too? Or no?
I am.
Okay. Oh, Janelle, sorry. Yes.
Yeah, I don't believe I'm on that one.
But I think as many people that can get on that strike force meeting, you guys are getting the emails, as many of you can, as if you have time to join in that meeting and even be on there to chat for yourself, I think that would be really helpful too.
So
Yeah,
Janet, the last time we had a strike force call though, there were very few questions that were answered. The strike team website has not been updated since October 15th, and there's some things that still haven't been updated since August. I feel like I'm beating my head against the wall when I put questions in there because nobody ever answers them. So
Okay, Maggie, we need to hold them accountable.
I know, so how do we do that?
Well, you know what, you need to document it. You need to document it and send it to us because we are on full force to keep them accountable for that because they have told us, here's how it happened. So keep them accountable and give us notation. You tried to call a number, you got no reaction. We need data. We need actual events that happened that didn't happen the way that they say they will because they are promising that we are out there for you guys. We're supporting you. So, yeah.
Yeah, they're not supporting us at all. And you know, and just like one of my really big questions is, my staff does not want to do vitals on this resident that has COVID. And I don't blame them. We're not medical. We really don't know. I mean, we're reading and trying to learn good infection control procedures, but we're not medical staff. And so we haven't been performing those on him. He's asymptomatic, so I'm not going to worry about it. And if I get written up for it, I'm going to get written up for it.
Well, I think you'll be okay because the first thing is you already know the person has it. So why are you going to take the temperature?
Well,
and the temperatures is the only thing that's required, not the pulse ox. The only thing that they're requiring is temperatures. They say it's a good idea to take the pulse ox, but it's not required. Because of what you said, Maggie, because we cannot assess and treat.
Yeah.
We are not medical.
I'm just, I'm so frustrated today.
Can I jump in and ask a question? Actually, before I do that, Jennifer, I think, has been trying to ask a question or say something for a while. So I'll cede the floor to Jennifer, and then I want to ask a question.
Wow, thanks, Michelle. No, I just wanted to share some of my own experience, and I wanted to do it in an abbreviated form. At the Gardens Care Homes, you know, we were so proud for so long that we didn't have COVID, and I second what Nicole just said. It's not if, but when. And so 2 weeks ago, we came down with our first resident having COVID, and I was concerned and on high alert and wanting to find an alternative location for that resident as well. Sent the resident to the hospital. The hospital wanted to turn around and have that resident come back within probably 16 hours saying she was fine. Meanwhile, I started the curative testing. Every single person in the house tested positive. So it went through the house like wildfire. I couldn't believe it. We just worked with CDPHE today and Jeffco Health department, and they were really, really great with us. And they were asking us some of the questions that you all are posing today, asking us if there was a designated wing that we could put people in. They're asking us, do we need to find an alternative location? All of switching rooms, all of that. So it may not feel, in my opinion, it may not feel like the words are going very far, but they're listening. They may not be admitting that they're listening to what's being said, but the state's listening. And I think we just need to continue to have these conversations with them and continue to approach it in a way that's proactive and acting as partners with them. And I want to say we're going to get somewhere. The other point I wanted to say is I really appreciate Cala sending out the email today about all of those resources. So Nicole, Tamara, everybody else on that group, thank you very much. We appreciate it. I'm done.
Thanks, Jen.
So I want to, go ahead.
I wanted to ask, Liz from Littleton posed a good question, and this is kind of what was on my mind too. She said, what would it look like if, as an AL community, we came together to create a COVID recovery center instead of waiting for the health department to do it? I mean, what would something like that look like? And Tamara, you said maybe they're doing something like that in Connecticut. I mean, who is doing these things? And I mean, is this a government thing? Is this a private sector thing? If it was a private sector thing, what would it require?
What I'm thinking is, like, those of us who've had outbreaks, if I've got a house that has 5 positives and 3 negatives, what would it look like if I call Janet and say, hey, Janet, do you have any, we have some sort of a database that has people who need placement for positive COVID for a respite. And we basically we're already having outbreaks. And what if we work together to let us have outbreaks together, because those outbreaks aren't going anywhere. So that was kind of what I'm thinking in my brain.
I totally agree. As a nurse working out in the field and doing placement and everything else, I absolutely agree. If there was a place, and then a shared staff too, because you have to have a COVID staff, because once they're with COVID people, they can't be with anybody else.
But that would be something that could be on that whole, we could have a list of places that are having the outbreak, and do they have any beds open? And if they do, then I can call and say, hey, I have somebody just tested positive. Yep. Can we snag that bed for 14 days? Absolutely. And vice versa.
That's why they're asking for the EMR resource to be updated on a daily basis. None of us are probably doing it daily, or maybe Nicole might be. I'm not. But that's why we're supposed to be doing it on a daily basis. I'm doing it at least 2 or 3 times a week, but that's supposed to give you the here and now data as far as who has beds available. Michelle, in answer to your question, the State Health Department has already told us that they will not be doing that. That will not be a government supported. And Peter said, why do we want government to manage something like that? It's going to have to come from the private entity. We're going to have to get some players to, grab funding. I mean, in Fort Collins, we just had the Penny store vacate. That's a huge building. We could have a medical supplier supply beds, and we could have oxygen equipment, and we could get little cubicles set up. I'm sure we could get some people to donate supplies. It's just then the staffing is going to be the issue. Who is going to staff that?
And to tag team on you, we've offered so many times to help the State Health Department put together a COVID recovery site. All we got to do is work with them, and they've pretty much shoved us out the door, that they don't want to work with us.
And I have to reiterate, Tamara, you cannot go to EM resources. I called every single place that said they were accepting. So that's a worthless resource.
They're trying to make it more user-friendly and more real-time data.
In New Orleans, they use hotel rooms. They get floors on hotels, and the CARES Act money from the state pays for the hotel rooms. The assisted livings and nursing homes just needed to staff it. So, I mean, again, I think we got to reach out to the private sector. I just don't know how to go about it. And I do know that Peter did briefly mention that the CARES Act was still available through the end of December. And we don't know yet if it's going to be extended, because obviously our friends in Washington are trying to decide that right now. But that's something that maybe we can look at, see, can we use CARES Act money, petition the state of Colorado to use some of the CARES Act money for something like this? Just throwing that out there.
Nicole, I even heard that they're using cruise ships.
So
it might be fun. Be sick on a cruise ship.
So here's what happened in Grand Junction. I've got a brand new facility. I don't have a license for it. The hospitals are getting full. They've asked me to use my building, but I can't put anybody in there because CDPHE will fine me to put more than 2 people in it before I have my license.
You
So
can get a waiver.
I've asked, and they refuse to return my calls. So therefore, they're worthless. I'm sorry, I'll just finish my venting right there.
You're
Okay,
among,
we need
you're
to hear
among
from you.
friends,
Yeah,
Wendell.
we need
You're
to hear
among
from you
friends.
because we need to present this to the strike force that you had a readily available building and they declined you because they are giving us bullshit. Sorry for the infraction on the language, but they are giving us bullshit when they say, if we could find a facility, we'll be more than happy to help you out. So we need your information and your, that you tried and they declined you.
Yeah, Tamara, I don't know if you've heard from Columbine Health Systems up here in the Fort Collins area. One of my friends is right now being trained because they're taking one of their buildings and converting it into a COVID building.
Yeah, I talked with Yvonne about 2 weeks ago, and we dialogued about that a little bit, and there was a mention of some empty beds in one of the assisted living places, and that they were gonna work on. I just haven't, I'll circle back with her tomorrow because I hadn't heard back
Okay,
from her.
and it's just, I don't know if you remember Dana White from Columbine Center Avenue. She's the one that's gonna be in charge of it, and they're training her right now. And I have her number if you need it.
Can you text
Yeah.
that to me? You have my number. Okay, that'd be great.
So Tamara and Nicole, do you guys know, I heard that CDPHE provided funding or I guess some grants to different entities at the beginning of COVID that would allow some of these different locations to be COVID specific. Was it just for skilled nursing? Did you hear that? Is that something that we can piggyback on for assisted living?
So that might be the MASH units that you're talking about, like they had at the Coliseum and up in Fort Collins at the ranch. And they were clearly MASH units, a cot and a curtain. And they were not designed for our population at all. And Elaine McMahon has clearly explained that to us. So yeah, the money was not going to help us out.
Can I clarify a couple things? Those who have had COVID in their house didn't, like Jennifer, the example you gave where you had one positive, you got that person out, and then you tested and everybody turned up positive. Isn't that the more likely scenario? And isn't it, or are some houses able to contain COVID inside their houses?
I don't know of anybody yet that's contained it.
We have our outbreak house that had 7 of the 8 have been positive. None of our staff that have worked at that house have been positive.
Wow.
So yeah, I mean, and before we realized there was positive, of course, staff go to all the houses. So it didn't transmit from staff.
And
it was really interesting to watch this.
That could be because they're PPE. Yeah, PPE, and the residents aren't as diligent.
Yeah, but and I actually think that's a big part of it. I think when your staff is diligent about infection control, regardless of COVID or anything else, I think when staff are diligent about that, that does play a huge role in this whole thing. But I did find that really interesting that, I mean, like I said, we watched it go through a house like norovirus would. And
what was your staff wearing?
None of our staff got it.
What were they wearing?
Our staff they're just wearing masks, gloves, washing their hands like crazy. I mean, we don't have a lot of PPE, so.
Liz, I was too, but I got it. I was diligent.
So did we.
I know.
We even did shields, we did gloves, we did masks, we did gowns, we did everything, and still some of the staff would come up positive.
And my son had it, and none of us got it, and his girlfriend didn't get it, and we know they're sharing stuff, so. I don't know why.
My question to you is, what did you do? Did you send them all out, or you let them stay in their home?
No, they're all there at the house, and none of them are symptomatic. So but it started with five positives, and then it went to 6, and then 1 was negative. I mean, like it just went through all but one resident has gotten it so far, and it's been 3 weeks.
You made the mistake, and I didn't realize until today when we talked to CDPHE and the health department that we weren't supposed to continue testing using the curative tests. So I was like, this is an experiment. So we're testing everybody twice a week. And it has been really interesting to see how everybody one by one gets tested positive, and then pretty quickly, I mean, it really has been like a 2-week outbreak. Now half the house is testing negative, and I feel like we're in the clear. Now, I guess I'd have to defer to Kim and some of the medical professionals here about kind of the inverse of what we were talking about earlier, in that if you're tested positive, is the negative result valid?
So my understanding is that you shed the virus for 3 months, and any given day you could be shedding it more than another day and test positive, and the next day you could test negative. So that's been, you know, the guidance that I've been following for the CDC and my medical director.
Okay.
So Jennifer, it sounds like everybody's has it, but nobody's really symptomatic or very minor symptoms?
Other than that very first lady who went out, everybody else is asymptomatic. We still did the quarantine. Everybody else is doing just fine. The lady who we sent out at the very beginning, she, you know, the hospital wanted to send her back very quickly. I was of the mindset that I don't want to infect the rest of the house, not knowing the rest of the house was already infected likely. So they kept her at the hospital for 3 or 4 days. They then sent her to rehab. And during that time, I did get some pushback from the hospital. I got pushback from the ombudsman about what my May 1st policy and procedures were for the infection control. I stayed firm and still didn't have her come back. She ended up going back to a different hospital, and her oxygen level, she was at like 20 liters of oxygen, which is very, very high. She needed a ventilator, but because she had a DNR, the family decided not to, and she passed. But the rest of the house, they are doing just fine.
That's phenomenal. We don't hear those stories, I guess. We hear, at least I hear, you know, people gets in the elderly and, you know, all hell's going to break loose, and, you know, hopefully they survive, like Rachel, most of theirs, all but one did. And so it's great to hear that too, that it's not the, you know, end of life or end of your story of your business when it does come in, that there are those success stories too. So thank you, Jennifer, for sharing that.
Yes, I appreciate it too, because I feel like it's going to go through my place like wildfire too.
And it probably will. So be prepared. Have your masks, have your gloves. Follow the Liz protocol. We all need to learn from her on how to keep everybody safe. And there's something that she did that we didn't do. So
we just tell people not to breathe.
There you go.
I found if you wrap them with saran wrap and duct tape, it works really well. And you don't get a lot of calls in the middle of the night. It's great.
Right. The other thing that I also wanted to mention was the staffing thing. Staffing is always such a challenge. During this whole 2-week span of having staff work in this home that was COVID infected, we offered bonuses for staff who would go in and work with COVID specific patients. We offered $50 per week per staff member. And with Christmas coming up, it seemed to be enough of an incentive. But while we offered the monetary incentive, we also made sure they had the proper PPE with the shield and the gown and everything else. There was a sense though, like what you guys were somewhat mentioning, you know, the staff is now seeing some seniors that have gone through COVID and are now testing negative, whether it's valid or not. And they have a sense of peace that they too can survive it. And it's not this big beast that we initially have seen on the news. So with the incentive, as well as with the safety precautions that we have put in place, I did not have problems with staff coming in. If you look on Indeed, I have ads running just about in every position that we have in the entire company. And I also have a full-time person who is calling and recruiting all day long. So
if you have any extra people, Jennifer, send them my way.
Okay.
We had good luck with a hazard, you know, running running a hazard pay ad just where the pay is really, really good, but it only is good for 6 weeks.
Yeah.
And we had some good results with that too. And we've even had a couple of people stay on and their pay was lowered because it was a hazard pay. And we had people stay on and agree to stay on and work. So
we've been paying our employees $2 extra an hour since March. And I can't, I'm a Medicaid only facility. We had our rates cut in July. I can't afford to even add more money to that. And then we're going to have in Denver, we're having a minimum wage increase in January. So I spent $3,000 for PPE today.
Yeah.
I don't know what I'm going to do.
Well, you don't want to know that the skilled places are paying their staff $88 an hour to take care of COVID residents.
Oh
Yeah,
my God.
That is the going rate when I called several skilled nursing units because they couldn't get staff to man the floors that had COVID. So they ended up paying double time.
Vern, can you set
$22
7
was
assisted
bad.
livings?
I'm sorry, what's
No,
that?
it's not assisted living, it's skilled. It's
Vern,
skilled
I have
care.
7 assisted livings. If you could sell them, I'm going to go work at a skilled nursing facility.
$88.
$88
Going with Liz. I've already been COVID. I'm
Exactly.
gonna go and
Exactly.
I don't need the stress of staffing. I'm done.
Imagine
just
being
putting
able
it
to
out
leave your
there.
job.
Yeah, I asked them, what do you pay people to work that floor? They said $88 an hour.
I have a quick question. Is anybody doing fit testing for their N95 masks with their staff?
I heard that they suspended the need to do that. CDC.
So we thought that, but then we heard someone recently had an infection survey and they were asked why they didn't get their staff fit tested for the N95.
I just saw it on the CDC website today.
So I know the state of Colorado has to adopt the guidance from the CDC as it comes out, because I also know today the CDC changed how long someone's supposed to quarantine for, but I just didn't know if people were using N95s, and if so, if they were getting fit tested.
Jennifer, how is since your staff is staying free of it, what are they using?
Well, my staff isn't necessarily staying free in the one house. We were just using surgical masks. And what the message CDPHE sent to me was that since KN95s were so difficult to fit, they felt like it wasn't as productive and as effective as just a plain surgical mask. Liz, how about you? Are you guys doing KN95s?
No, we have not done any of them. We've got a few just to make everyone feel better on the surveys, but no, we just do regular surgical masks, and we've got some with the filters in them that we wash, and so.
Yep.
I still am a firm believer. I know this is, I'm a nurse at heart. Washing your hands and your face. Like our residents who touch their face all the time. Well, shoot me, I bite my nails, so same thing.
Yeah, I think the touching, it makes a huge impact. I mean, you just don't even know you're touching.
I agree. I think that's a big reason why it was spread so quickly with our residents, because they're just not aware of, I mean, they're stabilizing themselves, they're touching other people, they're constantly fidgeting. And I really do think that's a big reason why it spread so quickly among them. But our staff, you know, we've had a couple staff who've tested positive as well. So it's not, you know, but I do think it makes a difference if they're, you know, really trying to wash their hands and stuff.
We had also heard a very large facility was concerned. They believed it traveled through their heating and air conditioning system because they had cohorted some of their clients in an area. They had specific staff, and there were people getting COVID, and they couldn't really figure out how. So that was another thing that I found to be interesting, and was wondering if no matter what we do or how we do it, if it's just going to travel.
Nicole, I heard the same thing from a skilled facility that has 40 beds. They said they quarantined and gloved and gowned and face shields and everything, and they do believe it's a life care center. Life Care Centers of America is convinced it goes through the ventilation.
Can I just remind everybody that when you're making decisions based on CDPHE advice, or you see, there's been a new thing on the CDC website or something, make sure to document it. Keep very, very good records of what you're doing and why and on whose advice. And that'll be hopefully never, ever needed or seen again. But if you do need it, then you'll have it.
As well as any conversations that you might call to get their support and who you talk to.
So this is Wendell. I have a question. I heard earlier that you could shed this virus for 2, 3, 4 months. I thought once you had it, in 10 days after that, you no longer could were infection, or you could not give it to anybody. So I don't know what you're talking about when you say shedding. Can you help me understand that?
So even if you're not contagious, your body still has the remnants of the virus. So it'll test positive, but you're right in that the CDC says that 10 days after the first symptom and 3 days past your last fever and no worsening symptoms, that's how they're defining contagious. But the shedding has to do with your body and the remnants of the virus in your body.
So you'll still test positive, but you're not infectious anymore.
Right.
Okay, thank you.
That's the rationale for not testing when somebody's positive. For those of us who were super curious about this whole thing, because I don't understand a thing about it,
but
I kind of like to retest.
But if there's false positives out there, what they're saying is, don't test again because we want to keep you positive. We don't ever want you to come back and say you never got it. And so
sometimes that's how it feels.
The numbers just build up higher and higher, whether it's really growing or not. I'm sorry. That's
well, no, Wendell, Aaron was just mentioning earlier that his resident has tested positive at the beginning. So, I mean, really, it's really going to be up to you on when they're not showing any, or they might have been very minimal symptoms, or you really are just questioning whether or not they truly have it. And he went out of his way to get this resident tested twice more, and it came back negative. So I really honestly think you need to do what's in your best interest for yourself and the residents to protect everybody, because goodness, this caused a lot of grief in his home on Thanksgiving. And what does that look like for you moving forward, or any of us really moving forward, you know?
So Rachel, didn't they say that you could test positive one day and still have it and test negative the next day?
So here's how we know what we know. And you can bring every scientist and epidemiologist to my front door and tell me I don't know anything. But we tested, so the first person tested on the 19th of November and came back positive on Thanksgiving Day. The second person tested that the day before and came back positive. The one who tested positive on the 19th of November is a resident in this house interacting with the rest of the residents on a daily basis. If we were positive, we would be having a full-on outbreak right now. Every single test came back today negative. I'm with you. The CDC may say one thing because they don't want the shedding result, but you have to actually be positive for that to make any sense. You actually have to have the virus. What Rachel's saying, be intellectually curious when you get those anomalies, because there are false positives. Who gave the statistic earlier that of all the different tests that are out there right now, that they've increased by 40% in nursing homes, but 50% of those are asymptomatic? Be aware that some of those are probably going to be false positives. That's my theory.
So then we're going to doing all these, the whole thing is, it's like ignorance is bliss. So unless they have symptoms and you test them, you could be getting these in and they're not right. And then your whole house goes crazy. Everybody freaks out. Your staff quits and you're screwed.
Yeah, I have no idea what to do with the next positive.
And if you really have had it gone through your whole residence, then why worry about it anymore? Throw away the masks, open your doors,
I like women.
According to the state, I am supposed to be completely we're wearing masks and we're still taking vitals. And I'm like, what is the purpose?
Yeah.
Okay, I'm going to jump in here real quick, and we are getting a little long in the meeting, and that's okay. And I know that we have a lot of things to say here, but just in the purpose of keeping our meeting moving along, I'd like to at least get our official meeting wrapped up here. And we're only 20 minutes past where we would normally be, or 25 minutes. So I want to move through the haves and wants and wrap up the meeting and then leave it open for discussion, because seriously, you guys could go on for 2 more hours. And that's okay. I welcome that this is an open forum, and we want you to be able to share ideas. But right now we're going to go through haves and wants, and I think I've got a few vendors on here who might want to tell people what they do and what service they offer. The haves and wants is for vendors to tell you guys what they have, or if you are looking for a partner, or if you're looking for anything, maybe you're looking for staffing or an administrator or whatever it is, or if you have something that you want to share with the group, that's what this point is. So anybody that has a have or want, I would ask that you raise your hand, and I will unmute you so that you can share it with the group. I know we have some vendors. Okay, Shelby.
Hi there, I'm Shelby Singleton. I am with Good Days Special Care Services Pharmacy, and I would love to visit with you further about your pharmacy needs and services and see what hurdles you are encountering and whether Good Day Pharmacy could be a good fit for you.
Hey, Shelby, I have a question.
Sure.
Do you actually provide medications for Kaiser as well?
We do. Mm-hmm.
That's a big one. Thank you.
You bet.
And Shelby, you have your information in the chat box there?
I
I'm
do.
assuming. Awesome.
I
Okay.
included it in there. Yes.
And good service. Very good service.
Terrific. Terrific. Okay. Do we have any other vendors who have a service they may want to talk about? Blake? Eileen?
Yeah, I think I just put mine on there. I'll talk real quick if that's fine.
All right.
Hey, so I'm Blake Crawford from Assured Partners Senior Living. We are a senior living insurance broker. We represent about 4,000 facilities across the country. Our biggest thing right now, or my biggest, is just trying to be as transparent as possible with coverages, especially relating to COVID and how your policies would respond to that, while also making sure to keep premiums down. There are a lot of creative ways to insure and insure correctly now. So I know costs are rising, and the best way to do is save some premiums. So that's what we're doing right now. Thank you, Kathy.
Thanks, Blake.
Good
And,
question to Blake.
Yes.
Yeah.
Vern, can I ask a question of Blake?
Certainly.
So my insurance has gone up $2,000 this year on liability, and I don't know if anybody else has seen that, but I'm assuming that's what you're kind of seeing in the industry with COVID this year.
It really depends. I mean, there's accounts that I've taken over that we've actually saved them premium from their renewal. So it really depends on the carrier, the coverages, things like that. So, when you go, I get pretty technical, but if you go to an admitted market versus a surplus lines market, you're not going to be paying the taxes and fees on top. And then you also usually get better coverages as well. So there are definitely carriers out there. I mean, I think industry norm right now is about 20% increase, but there are options to stay, depending on where you're at, stay flat or save some money by getting creative.
Blake, wasn't there legislation that was passed that makes it so that insurances are not going to be increasing, or they're taking communicable diseases out? Tom, my husband's sitting here explaining it to me. But we were talking about insurances and what we talked about earlier. If we have outbreaks, if I have an outbreak in all 7 homes, what's that going to look like with my rates?
Yeah, so that's one of the things that we're working on too. So the government is working on a national immunity to pass for communicable disease and, it's more specific to COVID. It has not passed from a government level yet, or from a federal level. It's being held up right now by the election, but I do imagine, so some states are passing it more on the East Coast now, just because that's where it's been hit the hardest. I would imagine Colorado, if not a federal immunity, would be passed at some point in time. It just depends on when the election gets settled out and push it through. But yeah, it has been in the talks, and I do think it's going to be coming. But right now, I would say 90% of policies have some kind of exclusion for COVID or communicable disease that is not covered. That makes sense. And I put my information too in the box too, if you all have any other questions or want to chat more about it.
All right, terrific. Anybody else? Would anyone else like to speak to the group? Something you have, something you want, something you're looking for?
Yeah, hi, Vern. This is Janet Cornell, and CALA has regrouped as an organization, and we invite all you to join our organization. We're doing some awesome educational seminars on COVID, and the membership is free right now till the end of the year, or maybe till the end of January. So we're trying to get a cohesive group with different organizations. We can join yours, you can join ours, and because we have different missions. We're driven for the group homes and government regulations. So if anybody wants to join CALA right now, just contact us and we would be happy to facilitate your membership for free. And then there's also some free educational opportunities from now. It's pretty pivotal right now because we're in the thick of COVID, but we're doing about every other week educations and then updating you on a regular basis what we're doing with the State Health Department.
All right, terrific, Janet. Okay, anybody else?
Well, I have a give.
All right.
I just wanted to, if you have a staffing need, I don't know if this is smart to put this out on here. I'm not sure, but email me. If we have some extra staff, I'm happy, and we're hiring some extra either caregivers or QMAPs. We're happy to share. So email me if you have a need, please.
Terrific, Jennifer. Thank you.
I also want to put out there, I don't know if you guys, I'm doing online QMAPs. So if you have anybody that you need to rush through the QMAP class, I'm going through a remote testing site as well. So if you guys need anybody rushed through that, let me know.
Awesome. And Liz, you have your contact info in the chat?
Yep.
Terrific.
And the scheduled classes on our website, but I know like when we hire somebody, if they need to be QMAP'd, we can get it through pretty quickly.
All right.
For a price, I'll QMAP anybody. No, I'm just kidding. Don't. I know this is recorded. That was a joke.
Hey, Liz, I have a question for you. How are you meeting the requirement for in-person testing if you're doing everything online?
So so we're doing, they approved it. It's through a testing website that is monitored, and I have to pay. I have to pay for it. And that's how I'm testing, doing all the tests.
Cool, thanks.
Yeah, that as far as I know, that's like they approved it. So as far as I know, the only thing I'm doing differently, which I have ways of doing it during the class, is the practical, which is not required anymore. But I have different ways of doing that during the class where people have to turn on their cameras and, we're demonstrating things.
Good. I also teach QMAP. Sorry, I was also wondering how you're getting by that because we're doing online for everything but the testing. So
yeah, let me call me and we can chat. I'll let you know the testing site I use.
Okay, great.
But yeah, as far as I know, they said it was okay.
All right, awesome. Liz, go ahead and put that your link on the chat so that everybody knows how to get onto that. Anybody else?
Just a minute.
Okay, well, let's see here. I'm just going to wrap it up. Again, our dollar, we're not charging right now because we don't really have any expenses. But when we do meet at restaurants, sometimes there are expenses. So we charge $80 for an individual and $120 for partners. And we're always looking for vendor sponsorship. And I've said this for the last 6 months. Coming soon, we'll be meeting at Torchy's Tacos on Arapahoe Road. I really don't know if that's ever going to happen, honestly. But I want to give them a plug because they offered to let us meet over there, and the food's really good. I don't know if you guys have ever had a Torchy's Taco, but they're really, really good. So I wanted to thank everybody for coming out tonight. I know the drive was not too bad, and parking was great. So we don't always have those.
Hey, Vern, I
luxuries.
wanted to say one last thing. I just wanted to say one last thing. We all need to stay united. Our industry is hard right now. So we need to all stick together, work together, and then we can make a difference. Because united, we have a bigger voice than individually. So we need to stay united either through CALA or through you guys. But we need to have a united voice out there because united, we have a bigger voice than when we stand alone.
Absolutely. Totally agree. And that's why we're working with CALA to try to bring their information to you guys and bring you guys to them so that we can make this community a little bit better. I will leave this open. So if you want to continue your discussion, you're welcome to. It'll be open as long as anybody's here. And again, this is recorded. We will put it up on the website once we're all done. And I, again, appreciate everybody's attendance tonight, and we appreciate you being a part of our group. So I hope everybody has a wonderful evening, and thanks for joining us.
Thank you so much, Vern. We appreciate you.
Thank you, Vern.
Yes,
Absolutely. Thank you.
Thanks, Vern. Stay well, everybody.
Vern.
Thank you.
You bet. Bye, all.
Bye-bye.
Jennifer, if you're still on here, this is Maggie. So I'm looking for overnight staff. They don't have to have any experience. I just need somebody to run around and get things for residents and stay awake all night.
I think
she's gone.
She's there.
Here, sorry, I had to unmute. Maggie, do you need them to sleep or are they awake staff?
They're going to be awake at night because they're going to be running around.
Okay, please email me. Otherwise, I won't remember. If you
Okay, I will absolutely do that. I got your email.
Okay.
So thank you so much. I appreciate it.
You guys actually have sleep staff? Do you guys?
We do have sleep staff. I have 3 people that are sleeping, but they have, other jobs and they can't stay awake all night. So I need somebody who can do the running around.
Maggie, that's going to be the Board of Health. That is, that is a big topic of discussion for Chapter 7 regulations. Do you know that?
I used to be on the ALAC committee.
Oh.
So it was a issue when I was on the ALAC committee.
It's coming down. They're wanting to get rid of that. Just so you.
Oh, I know they
Yeah.
do. They've been wanting to do it for 7 years.
So I have a question about sleeping staff. So we just have a small home and we live in it. So I can't be awake 24 hours a day.
No. And what I've heard, Rachel, tell me if you've heard differently, but what I've heard is you have to make sure you do one check between 11 p.m. and 6 a.m.
Yeah, well, I do a check. It's between 10 p.m. and 6 a.m.
Yeah.
So as long as we continue to do that, then we're okay with the state.
Yeah, as long as you're not memory care.
And the
other thing is,
no, we're
too,
not.
if you want to get by, this is another thing, because my residents pretty much sleep through the night. My caregivers sleep upstairs with them on a pull-out. She's real close. But what I did is, for my residents, and they agreed to it, they all signed off that they did not want to be bothered from this time of night till this time in the morning. Hence, that took away the bed checks. They said, we don't want you coming in our room. We don't want you opening our door. We want to be left alone. And I've got that all in their care plans. So that way, for my assisted living and the residents I have, we don't have to do the bed checks.
Yeah, we have that in our residential agreement as well. our state survey lady that came out said that was perfect to put it in our residential agreement, and they sign off on it whether they want it or not.
Yeah, we have the same thing in our care plans too, that they
Okay.
don't want to be disturbed. And we've had a survey and it was okay as well.
Okay.
And here's another workaround. The regulations do expect you to have a QMAP 24/7. They always have to be at the house. So you can have a QMAP that's typically a higher paid employee. They can be there and they can be sleeping as long as they're accessible. And then you can have a care partner or a caregiver working the floor, alert, doing the cooking, doing the cleaning, and you're still in compliance.
Okay. Okay. Thank you.
All
So,
these
yeah.
regulations in Chapter 7 really are not helping anybody, especially with Medicaid.
No, it's awful. I'm doing more and more with less and less.
Absolutely. Absolutely.
And they came out today with the testing. We are going to have, I don't know if anybody else got it, but I got it on a fax today that we are going to have to start reporting all of our testing through a portal on a website.
I thought Curative was doing that.
Well, I emailed Elaine today to find out, since we got that fax or we got that notification, are they handling that with Curative? And I think since they're the one telling us we have to test, that they should be the ones to go out and get the information from Curative, because, you know, there's no more time. There's no more time for this kind of stuff. So I haven't heard back from
I think it was November 20th.
So Janelle, isn't it your understanding that Curative was going to turn in the results to the state? Because I was on a meeting, the infection control meeting today, and they said that it was our responsibility to turn the results in.
That's my point. And that's why I reached out to Elaine today, because I'm like, why, if they're having us do the test and they're picking the company, then why aren't they turning it into the state? Why are they coming back to us to turn it in? I haven't heard back from Elaine yet. I'm still waiting to hear back her answer from that.
So there was something in EMR when you log into your EMR and you fill out the stuff for the state. There was a big thing that popped up that said that exact same thing, that every facility is going to have to report the name of the patient, their address, their birth date, and their test results.
And I don't know, I seemed everybody that I talked to today, nobody got the paper but myself.
No, I didn't get it.
And it's going to be by the 21st. They said it has to be, you have to have it up and running by the first, I think it was the first
January
of the
1st
year.
is what it said on that flyer.
So I just pulled up EMS and I don't see that there.
Are they talking about the spreadsheet that they're wanting us to fill out?
I don't know. I know that you have to go log in and put all the information in. Nicole tried to get into it today, into the where they had to click on it to get in, and she said she couldn't even get into it. So I'm not sure. That's why I reached out to Elaine. Also, we did get a couple weeks ago, I got something from Elaine, because we've been all bothering her so much. Maggie, this won't affect you, I'm sorry, but about new guidelines for the small assisted living homes. And she sent it to me, but nobody else I know has received that.
I got that.
I didn't either. I didn't get
I got it, Janelle. And I
You
don't,
got
I'm
it?
not a, yeah, and I'm not a small assisted living.
Because everybody I've talked to, I've been emailing it to them because they never received it. So I don't know why some people are getting some things and some people
The
aren't.
only reason I got it, because all of my homes are small, is because Ella sent it out today.
That's because I gave it to Calla. I'm the one that gave it to Calla, and Calla sent it out.
Interesting. Okay.
Yeah, that is interesting. I definitely got it today.
It was because we put it out. I gave it to Calla for Calla to send it out because nobody had gotten it. And Elaine, when she sent it to me, she said, I know that you've been anxious for this and you've been bugging me about it. And she said, so I'm sending it to you. And she said, it's being posted as we speak. And that was on November 20th and nobody received it. So I don't know if it isn't real anymore, but when she told me it was being posted as we were on together, I just figured that it's done. So I gave it to we talked, I work with Calla, I'm on Calla, the GRC committee. But anyway, So I gave it to them and said, nobody seems to know this. And so when you read
Janelle,
that,
I just looked and it was from Cala. It wasn't from the state.
and if you read on there, if you go down, I think it's on the last page, it also says in there about not having to take residents back. If they are not safe to isolate or they're not out, read it thoroughly. The changes I saw were that, and also I think they can dine together now if they're not sick. So you guys need to, really look through it, but I don't know why nobody got it. And Elaine sent it to me because she knew I'd been bugging her for it, because they've been saying they're going to come out with it for 6 weeks and hadn't come out with it. So I'm not sure if it's gospel or not, since nobody else got it, but I don't know why she would send it to me and tell me it was going to be posted.
I found it after digging on the state's website, but the communal dining is not very clear.
Yeah, I wasn't real clear on that, but you did find it on the state's website?
Yes, after a lot of digging.
So why didn't they send it to us? I mean, they're sending us every other COVID update rule and regulations we have to follow. Why didn't they send that to
So
all of
Janelle,
us?
when you get a response from Elaine, will you post it on Vern's Facebook page so we all kind of are know and are aware of what we need to do and where we need to go with it?
You mean with the
that
testing?
specific small ALR guidance document?
Okay, I didn't get with her on that today on why. I did email her today about the having to go with the curative, and are we still having to do that if we're a curative? I can go out there, especially since is that Keely that said that you saw it on the state's website?
It was pretty far down there.
Okay, since you saw it on there, then I will hit Elaine tomorrow, and yes, I will post it as soon as I hear back from her on both of those.
Awesome.
Thank you.
But this is why, this is it, you guys. I mean, that's what they said, we got to stick together, and try and, work together on all this. And, I was really against Cala. I hated Cala. I was never going to join Cala. And when myself and Tamara and Rachel and Janet all got together and started working on this stuff, the reason that we all went with Cala is so that we could have numbers behind us. So that way we're not fighting everything by ourselves. So that's the only reason we even joined Cala, because I didn't want anything to do with them, but we need numbers. We need to have numbers to fight some of these things that we need to help us survive.
And I will join tonight, but I'm for the same reason. I was in several meetings with Corky, and he embarrassed me.
He's fired. Maggie,
I
he
just
got
heard
fired.
that. I just heard that today.
Yeah, we did a hostile takeover. The president
Good.
no longer was the president. We got Corky fired. The
So
bitches
who's-
with balls went in and just took the whole thing over and put everybody on the back burner and said, we're going to do
Who's the-
this.
who's
We're
the
going to do it
president now?
with Cala. Nicole is the president.
Congratulations, Nicole.
She's no longer on the call.
Oh, okay, well, I'll have to congratulate her.
Yeah, I mean, we did pretty much a hostile takeover, because if we couldn't do it through Cala, we were going to make our own group. And so we
Well, and Cala wasn't
so we
representing us anymore. I mean, we were like, who's showing up for these? We're kind of doing all these things on our own.
All they were doing is taking money from you.
Yeah.
Right.
Yeah.
So, and it got, especially for us, the Medicaid only facilities, it got kind of expensive.
Yeah, absolutely.
So,
absolutely. And yeah, you guys, Medicaid really needs representation, definitely.
I just posted the link to this rapid response thing that was on the website.
Oh, good.
Thank you.
So Maggie and Janelle, just I used to belong to Cala as well, and when we were first coming into the industry for the first year, and I think something that is really, really important to me, just for your perspective, is that we can grow and have a lens of what we can do, not necessarily what we can't do. And sometimes I know that's challenging working with CDPHE, but if we're adversarial with CDPHE, we're never going to get anywhere with them. And I think I truly think that their intention is to help support seniors. They're coming at it from a different lens. So I would love to join CALA again, but I want resources that are going to help me be better. I don't want to hear about what CDPHE is doing wrong, because that doesn't.
Yeah, I agree. I put that in the chat earlier, come up with solutions. Don't just tell us, don't go into a meeting and complain about everything. Figure out a way that we can do it. I used to be on the CALA board for 3 years in the early 2010s, and I felt like we did a lot, and then we had people come in who all they wanted was the money to come in, and they stopped focusing on educating, on helping. And so that's why I stopped.
Yeah, no, I agree. And that's what we're trying to do. And when we are presenting to CDPHE, we're not presenting to them that we're picking on CDPHE. We're presenting to them, we need help. This is what you told us you could help us with. Help us figure it out. And that even when the surveyors came to my house, I said, look, you guys, I said, help us. We don't know how to do this. We don't know what we're doing. We don't need you coming in and jumping on us. Help us. We want to, help our people. So we all agree with that. We don't want it to be bitch sessions. We want to get something done. And that's why we did the COVID white paper for the small assisted livings. That wasn't to bitch at CDPHE. That was for our residents to be able to eat together, to be able to come out of their rooms. So we don't want it to be a bitch session. That wastes our time.
These are all the complaints that we're hearing from the ombudsman. Ombudsmans are really put up to a wall because of the rights associated with the residents at this point. And so we've been trying to, I mean, really collaboratively, we've been trying to work with them as well. And who is it? Who's the head of
Shannon Gimbel?
Yeah. So she's definitely on board, and she sees our vision, and she understands, like, we are definitely a specialty. And honestly, when I had my outbreak, the epidemiology team, they didn't understand my concept. They had no idea. They're like, well, do you have a maintenance crew? Do you have a cleaning crew? And I'm like, yeah, that's called me, myself, and I. And so, it's all about education. You're right, Jennifer. It's all about education and them understanding our setup and and we're all trying to have a place for these people to go, especially for Medicaid. There's no place. They're becoming limited. Like, who wants to have a Medicaid place when there's the reimbursement is horrible. Horrible.
Well, and then I also have the added disadvantage of all of my folks have mental illness. And and it's a completely unique perspective from, totally different from elders, totally different from small assisted livings. And they never talk about that either. I would love for CALA to have like some kind of subcommittee or something that addresses some of that too, because there are a lot of us that are Medicaid, mentally ill only.
Yeah, it's definitely.
Trying, Maggie. We're gonna give it. We're gonna give it a college try. If it fails, it fails. But we just needed to have. There was things I was doing on my own. There was things other people were doing on their own. And we just figured, if we could get together and brainstorm to get help for us and our residents, because this is about our residents and how hard it is on them. I get to go home at night. My residents are in Groundhog Day every flipping day.
My residents are confined to their room for God knows how long now.
I know.
For a month,
horrible. Maggie. A month. No.
A month.
I'm sorry. I'm laying it out for you.
I know, 28 days. I know, I'm counting down.
Merry Christmas.
Oh my gosh. Yeah, and see, that's the other thing. It's at Christmas. That I was calling families yesterday and today, and everybody we talk to is like, it's over Christmas. I'm going, yes, I know. So I have a bunch of them bringing Christmas presents by tomorrow.
You know what, Maggie? It too will pass. Hang in there, Maggie. It's going to pass. You know how quick time goes by. You're going to look back at this and say, I made it. Like I told Rachel, and you're going to have made it. You're going to be a soldier. And then guess what? You're done. Like Rachel, I mean, it really stunk for her to go through it. Now she's finished. Everybody's had it. She's kind of like got the get out of jail free card.
Yeah.
Now,
That's what I'm waiting for, because then I'm selling the place. I'm getting out of here. I'm tired of this.
All right, I'm signing off, you guys. So nice to meet you all and talk with you.
You too.
I'm
Jen,
signing
I'll get in
off
touch
too.
with you.
Bye,
Thank
guys.
you.
Good night, everybody. Great,
Me too.
great
Thank
discussion.
you. Good
Thank you,
night.
everybody.
Thank you.
everyone.
Hey, Maggie, are you online?
Yes, I am.
Okay. Is it possible to get your number so I can call you offline?
Yes.
This is
it's-
Mohammed.
Okay, it's 303 725 7659.
Thank you, Maggie.
And Mohammed, could you call me tomorrow instead of tonight? Because I'm going up to, I had a late night last night. So I'm going up to bed.
We'll do that. How early tomorrow?
Let's say after 8:30.
Okay, perfect.
Is
will
that
do
okay? Or do you want to talk now?
If possible, now will be great, but if
Okay.
not,
Why
it
don't
can
you
wait
just give
till
me a
tomorrow.
call after you get off?
Okay, we'll do. Thank you.
Okay, all right. Thank you. Bye-bye.
Bye bye. Thank you, Vern.